my name is Leah. I am a family nurse practitioner student, and today I am going to be performing a physical focused exam. I'm going to be starting off with the abdomen, then the musculoskeletal system, and then the neurological system. Before I begin, do I have your consent to record and perform this exam today?
Yes.
Okay. So great. We are going to get started. We are first starting with the abdominal exam, where we are going to start off with inspection. If you can lift your shirt up, we're inspecting for contour, we're inspecting for symmetry, any masses, any lesions, any scars. None are present. The stomach appears with no masses, no lesions, scars, and the skin appears smooth, clean, dry, and intact. And then we are going to move on to auscultation. So I would auscultate. We are listening for bowel sounds. I would listen in the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Bowel sounds are present and they are normal active throughout the abdomen. Next, we can auscultate for any bruits. We would auscultate with the bell of our stethoscope, and unfortunately mine does not have it, but I would first start off by auscultating the aortic artery, which is going to sit midline right above the umbilicus. And then I would listen to the right and left renal arteries, which is above the umbilicus, right and left iliac arteries, which is below the umbilicus, more laterally. And then I'm going to defer for the purpose of today's exam. I would also listen to the femoral artery, left and right. Then we can move on to percussion. So I would percuss starting in the right lower abdomen, right upper, left lower. Tympany is heard through out the abdomen. I then can percuss liver span. This is going to start at the midclavicular line. So I would start at the top, work my way down. When I hear dullness, I would mark that area and then start from below, again, midclavicular line. Where I hear dullness, I'm going to mark that area, and then I would measure the span between those two marks. So normal liver span is between 6 and 12 centimeters. Anything more, we're concerned for hepatomegaly. Then I'm going to move on to palpation. So we're starting off with light palpation to the abdomen and to the flanks. We're looking for any organomegaly, any masses, any pain or tenderness. So I would start with light palpation. And then also we can do the flank. Good. Any pain?
No.
Okay, no pain. Everything's normal. Moving on to deep palpation, where we're assessing for the same things. And we're going to do that in the abdomen. Good. And then at this point, I can also assess for rebound tenderness, again in the abdomen. Any pain?
No.
So it is a deep palpation with a quick release. And then I would move on to palpation of the spleen in the left costal margin. So you can take a deep breath. Good. So I do not palpate, I can't palpate the spleen, which is normal. If you do palpate the spleen, that could be concerning for splenomegaly. I could then move on to palpate the aortic pulsation, again, midline above the umbilicus. So you would palpate it, and then you'd use your 2 index fingers to measure the width of the aortic pulsation. And normal width of aortic pulsation is between 2 and 3 centimeters within normal limits. Then I'm going to have you sit up so I can do, we can now lightly percuss for CVA tenderness. I'm going to have you turn around on your back. So this would be done at the 12th costovertebral margin, below the 12th rib, and you're doing your non-dominant hand and doing a light percussion. Any pain?
No.
Okay, perfect. So that concludes our, you can lay down, our abdominal exam. Then we're going to move on to musculoskeletal exam. So we are going, actually you can sit up. sorry. We can start off with musculoskeletal. We're assessing for range of motion. We're assessing for strength, looking for deformities. Everything is symmetrical. We're going to start with the neck. So we're going to inspect, palpate. We're assessing for any pain, any tenderness, making sure things are symmetrical. So we're for range of motion, we're going to do flexion, so back, extension, forward, right lateral bend, left lateral bend, rotation to the right, and rotation to the left. And then for strength, go ahead against my resistance again, and then to the side, and then you can do bending. Good. Strength is equal, 5 out of 5 bilaterally. And then we're going to move on to the shoulders. So we want to inspect, we want to palpate the shoulders. We're looking for any pain, tenderness. We want to make sure the shoulders are symmetrical. There's no warmth or redness. For range of motion, we're going to do flexion, extension. We're going to do abduction, and then adduction, internal rotation, and then external rotation. And then for strength, we can assess this by, don't let me push, good. Good, and then abduction, good. And then let's do flexion, don't let me push, good. And then internal rotation, good. And then external rotation, good. Strength is 5 out of 5 bilaterally. Then we're moving on to the elbows. So we're assessing the elbows. Again, I would have them in a Johnny, but we're inspecting the elbows for any redness, any warmth, any swelling, tenderness. We're making sure things are symmetrical. Again, for the purpose of the exam, I'm only doing one side, but we would do both sides. And then for range of motion, we're doing flexion, extension, supination, and pronation. Good. And then for strength, you can do flexion, don't let me push up. Good, down, good, and then supination, good, good. Strength is 5 out of 5 equal bilaterally. And then we would move on to the wrist and the fingers. So let's start with the wrist. We're inspecting, palpating, pain, tenderness, inflammation, any swelling, redness, flexion of the wrist, extension of the wrist, radial deviation in, and ulnar deviation out. And then for the fingers, make a fist for extension, flexion, widen those fingers, good. And then for strength, let's do your wrist for strength, don't let me push, good. And then in, good, and then out, and then put your hand in a ball, don't let me open, good. And then widen those fingers, don't let me push down, up, and then test for grip, strength, good. 5 out of 5, again, good strength. Then we are going to move on to the hips, so you can lay back down. So for the hips, we are inspecting the hips. We're making sure that they're equal, symmetrical. There's no swelling, no warmth, anything along those lines. And then for the hips, we're going to do flexion. So we're going to bring our leg up, good. And then extension, you're going to have to stand, and then bring your leg back. I'm going to test for strength here, so don't let me push down, good, and then push up, good. So go ahead and lay down. Then we're going to do abduction, bring your leg out, and then adduction, bring your leg in. And then we can also do external rotation and internal rotation. Good. And now for strength, don't let me push down. Good. Up. Good. Abduction. Good. Adduction. Good. And then good. And good. Strength 5 out of 5. Okay, then we can do your inspect and palpate the knee. Again, symmetry, pain, tenderness, warmth, any redness. Everything looks intact. So for your knee, we are going to do, you can roll on your stomach. And then what you're going to do is bring your heel to your buttocks. Good. And then let's test for strength. Good. Good. And then go back to your back and straighten out your leg. Good. Don't let me push. Good. And push. Good. Strength is 5 out of 5. And then we can, if you want to sit up, we're going to do your ankles. So for your ankle, we're going to do plantar flex, yeah, and then dorsiflex, and then we're going to do inversion, and then eversion. Good. And then strength. Good, good, good. Okay, 5 out of 5. And then we're going to move on to the spine. Go ahead and stand up. So for the spine, we're really looking to make sure things are symmetrical, that things are straight, that there's no curvature, there's no deformity noted. Flexion, we're going to have you bend forward. Extension, come back. Right bending, left lateral bending, rotation to the right, and then rotation to the left. Perfect. So that concludes our musculoskeletal exam. Next, we're going on to the neurological exam. We are first going to start off by assessing mental status. Tell me your name.
Travis.
Where are you?
Home.
And what year is it?
2025.
Patient is alert oriented times 3. We're going to move on to test his cognitive function using memory. So I'm going to tell you 3 words. I want you to repeat them to me later on in the exam. They are apple, dog, and penny.
Apple, dog, penny.
Perfect. So next we can test higher intellectual thinking by giving him a scenario, see if he responds appropriately. You're in a movie theater and you smell smoke and see a fire. What would you do?
Scream, run, and call 911.
Okay, perfect. So patient responds appropriately, indicating higher intellectual functioning is intact. And what are the 3 words?
Apple, dog, penny.
Perfect. So memory is intact as well. Now we're moving on to the cranial nerves. We have cranial nerve number 1, which is our olfactory nerve. So you're going to close your eyes, and I'm going to have you close one nostril. Close one nostril. Smell. What is it?
Vanilla.
Perfect. So vanilla is correct. And I would have him do the same on the opposite side. Next, we're moving on to cranial nerve number 2, which is our optic nerve. We are testing for visual acuity. I would use the Snellen eye chart for this to test visual acuity. Then we can test visual fields. So for this purpose, I want you to look straight ahead at me. And then we're going to test for visual field and tell me which hand my fingers are wiggling on. Good. 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 So cranial nerve number 2 is intact. Moving on to cranial nerve number 3. This is our ocular motor nerve. We're testing for pupillary constriction, which I will get my pen light. I know how to turn it on.
It's on.
Oh. There we go. So look straight ahead. Good. Pupils are equal, round, and reactive to direct and consensual light. You can also test for accommodation, so look straight ahead. Good. Pupils constrict and eyes converge. Cranial nerve number 3 is intact. Cranial nerve number 4 is the trochlear nerve. And then cranial nerve number 5 is the abducens nerve. And then that is testing extraocular eye movement. So you're going to look straight ahead and follow my finger without moving your head. Good. Extraocular eye movement is smooth and intact. There's no nystagmus or strabismus noted. Cranial nerve number 6 is your trigeminal nerve. We are looking at sensory and motor. So for motor, we're testing our jaw strength here by down. Good. And you can check the master as well. So strength is equal bilaterally both sides. For sensory, we would do light and sharp, dull touch sensation. So close your eyes.
Soft.
Good. Is it equal on both sides?
Yeah. Soft. Soft.
Equal both sides?
Yep. Soft.
Good. And then...
Oh, sharp. Sharp.
Equal both sides?
Yep. Yep.
Equal both sides?
Yep.
Okay. And then we're moving on to cranial nerve 7, which is our facial nerve. So this is where I want you to smile, frown, and I want you to puff your cheeks out and raise your eyebrows. So movements are symmetrical on both sides. Cranial nerve number 8 is the whisper test, where acoustic nerve, I would technically stand behind the patient. I would whisper word,
dog.
I would do this on both sides. He was able to say the correct word. Hearing is intact. Cranial nerve number 9 is the glossopharyngeal nerve, and cranial nerve number 10 is the vagus motor nerve. So I would have a tongue blade, and then I'm going to have you open your mouth. I want you to say ah.
Ah.
Good. So the uvula rises midline, voice is intact, swallowing looks intact as well. And then we have cranial nerve number, that was 9, 10. Cranial nerve number 11, which is the spinal accessory nerve. So to test this, I'm going to have you shrug your shoulders against my resistance. Good. And then against my hand. Good. Strength is equal and symmetrical bilaterally. Then cranial nerve number 12 is the hypoglossal nerve. So I want to have you stick your tongue out. Good. The tongue protrudes midline. There's no deviation. Everything looks intact and symmetrical. Now we are going to move on to deep reflex, the deep tendon reflexes. So we're going to do our bicep. So just relax here. Good. So 2+, and then tricep. Good. 2+, and then brachioradialis. This one's a little tricky. Good. 2+, and then we'll do your patellar, which I'll have you sit here so we can just, yeah, thank you. We're going to do the patellar. Ready? Good. 2+, and then for the ankle, we can do Achilles, which you put in dorsiflexion. Good. 2+, and then we would check for plantar reflex with Babinski. Good. The toes fan inward, which is a normal response. And then we would also check for clonus. So we would put the foot in dorsiflexion and let it drop. So this is normal. What's not normal is if we would see like fast rigidity movement. Perfect. Next, we are going to test sensation. So for sensation, we can do a light. You can lay down. We can do light sensation and then sharp, dull sensation.
Use the black thing so I don't mess it up.
Okay. So for light sensation, we're going to have the patient close his eyes. So we would have him in a Johnny. I would first test his shoulder.
Soft.
Good. And then I would test it on both sides. Is it equal on both sides?
Yes.
Okay. And then I could also do
Hard.
sharp. Good.
Sharp.
And then
Sharp. Sharp. Sharp.
equal on both sides?
Yes.
Okay. And then I could do soft as well. We could do the hand.
Sharp. 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 Sharp.
Good. Equal on
Sharp.
both sides?
Yep.
Okay.
Soft.
Good.
Soft. 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 Soft.
Is it equal on both
Soft.
sides?
Yeah.
Good. And then I could also do the toes, checking again for light and sharp sensation. Perfect. And then you can sit up. Then we're going to move on to coordination. So for coordination, we are, okay, so you're going to point to your nose, and then I want you to point to my finger. Good. So coordination movements are smooth, accurate, and intact. And then we are going to move on to gait. So for gait, I'm going to have you stand up, and I want you to walk to the computer and walk back to the couch. Good. So his gait is smooth. There's no balance issue. He's coordinated. And then tandem walk is heel to toe. You can go good and then come back. Perfect. So again, there's no balance issue. Gait is intact. No issues at all. So that concludes our physical exam today for abdomen musculoskeletal and neurological exam. Thank you for participating, and we are all done.